Tonight, Prime Minister Alan Shastri has indicated that the possibility of closing our borders to foreigners is very much on the table in the fight to protect the nation from coronavirus. St. Lucia holds a national health security meeting with senior officials from all relevant government ministries after the World Health Organization advises all countries to be prepared for containment, active surveillance, and early detection in relation to coronavirus. And family and friends of Victor Morris grieve his loss with the general public in a vigil. We have the details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Friday, the 31st of January, 2020. Welcome to the Hot 7 TV Nightly News. We're on Flow, Channel 117. The broadcast is also being simulcast on KISS FM. You can watch via our website. It's www.caribbeanhottv.com or on our free Caribbean Hot FM mobile app. I'm Lovely St. Amy Joseph. Thank you for joining us. On Thursday, the World Health Organization, WHO, declared a global health emergency over the new outbreak of coronavirus. The number of coronavirus cases worldwide has surpassed that of the SARS epidemic, which spread to more than 24 countries in 2003. There were around 8,100 cases of SARS, which is severe acute respiratory syndrome. It was reported during an 8-month outbreak. Now, nearly 10,000 people have been infected with the new coronavirus, most in China, since it emerged in December. More than 100 cases have been reported outside China in 22 countries. The number of deaths so far stands at 213, all in China. In total, 774 people were killed by SARS. 2 cases of the virus have now been confirmed for the first time in the UK. That confirmation came on Friday. Now, Prime Minister Alan Shastri has indicated that the possibility of closing our borders to foreigners is very much on the table in the fight to protect the nation from the deadly coronavirus. He said the government is working with the WHO on the matter. However, he says he will not hesitate to do what is in the best interest of the people of St. Lucia. Rochelle Gonzalez reports.
Prime Minister Alan Shastri has revealed that he is not closed off to the idea of closing off the borders to foreigners coming into the country if it is the way and means of protecting nationals from the deadly coronavirus. Prime Minister Shastri said he is working closely with the sectors charged with overseeing the processes and proper protocols. However, he made an assurance that the well-being of the people remains a top priority.
So I know that the WHO and everybody are working collectively together to try to contain it as much as possible. Sadly, we're still dealing with a virus that we don't know a lot about, and that's what makes it more scary. So, is 100 people dying too many? Is it not enough? Or nobody really knows. And certainly in terms of how containing and what makes it dangerous is that, it takes a person 2 weeks before they know if they have the virus. So there's a lot we're learning, but any virus that goes crazy could have a substantial detriment not only on tourism but the whole global economy. Everything can come to a potential standstill. I mean, when you talk about hearing cities are being locked down, cars are being banned from driving on the roads in order to that's pretty draconian steps. So sadly, we can only prepare for the worst, and I think that's what people are doing. And I want to assure the St. Lucian population that we're working very closely with the WHO and following the protocols very carefully.
The PM said whilst tourism remains a vital industry to the St. Lucian economy, protecting the St. Lucian people comes first.
Do you see potential travel bans for certain jurisdictions?
Could. I don't know. Again, we're going to work with the WHO and all the international organizations in order to make that determination. But St. Lucia will certainly always put the safety of its people first before any business.
To date, the coronavirus has killed over 170 persons, and a confirmed case in Tibet means it has now reached every region in mainland China. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
Meanwhile, former Chief Medical Officer Dr. Stephen King says authorities should focus on the travel history of foreigners coming into the country rather than their race whilst worrying about the spread of the coronavirus.
The island's former Chief Medical Officer, Dr. Stephen King, is calling for persons to take a more objective approach to the situation surrounding the spread of the deadly novel coronavirus. The threat of the virus, which has to date killed over 170 people, has led to mass panic, with persons scrambling to seek out solutions to remain protected from it. Since the virus originated from China and has since spread across Asia and international borders including the US and Canada, the concerns have been raised, leading to persons calling for borders to be closed off to Asians. Dr. King said this call is pointless as the virus does not discriminate and that race is a non-factor.
A Chinese national is no more at risk than a St. Lucia national. You have to be exposed to people or animals, or you have to be in that environment. So it doesn't really matter your race. Your race is not the issue. It's where you are and what you get exposed to. And I think your travel history. So this is where the ministry comes in. Travel history is very important. So when people are coming into the country, where are they traveling from? We need to know that. And that can be done. We have the manifests that you can know where people are coming from. The information systems are there. The Ministry of Health must obviously stay on top of that. So if you have somebody coming from an area in which there's a coronavirus, then clearly they have to be specially examined and make sure that they are actually safe and are not infected.
Dr. King said as a medical professional, he is going to cooperate fully with the medical fraternity to aid in the fight to keep the virus out of St. Lucia.
The data on the coronavirus is still coming in. So there's no doubt that we have to start preparing. The Ministry of Health, I think, has made a statement. Dr. Belmar George has made a statement. I believe that we need to support the Ministry of Health as a medical practitioner, as a director of a laboratory. It is my responsibility to work with the government to try and make the country as safe as I can, to participate in the surveillance, so that we can try our best to keep things safe.
In the event that the virus reaches St. Lucian shores, Dr. King said the most basic hygiene practices will work effectively towards keeping it at bay. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
The World Health Organization, WHO, has indicated that they expect further international exportation of coronavirus cases which may appear in any country. They advised all countries to be prepared for containment, including prevention measures, active surveillance, early detection, isolation, case management, and contact tracing. Here on island, a national health security meeting was promptly held on Friday. St. Lucia's Department of Health and Wellness has noted the escalation in the classification of the outbreak of the coronavirus and continues to strengthen its system to reduce the possible impact on our population. Chief Medical Officer Dr. Sharon Belmar George says at a national health security meeting chaired by the Cabinet Secretary and attended by senior officials on Friday, the 31st of January, the Ministry of Health presented on the coronavirus disease and the present level of preparedness.
The Department of Health and Wellness has updated its existing influenza preparedness plan, and we continue on the following: education and sensitization of healthcare workers, non-health workers, stakeholders, and the general public. The communication and health education will be further heightened in the coming week as our teams will be participating in various media programs. The enhancement of the Port Health services. The Department of Health and Wellness, we have met with the senior officials of the St. Lucia ANC Ports Authority with a plan to strengthen surveillance and Port Health services. Training has also been conducted at the two main airports for the relevant port workers.
The ministry has also continued its active surveillance at high-risk institutions like ports of entry and hotels and has beefed up its prompt recognition strategies. Dr. Belmar George outlined other measures being taken.
Ensuring the isolation of ill cases in designated hospital isolation rooms, establishing diagnostic capacity through the Caribbean Public Health Agency, facilitate contact tracing and quarantine of suspect cases, and the promotion of general hygiene measures and infection control for border agency, healthcare personnel, and the general public. In the interim, The public is asked to continue practicing standard recommendations to prevent the spread of infection.
St. Lucia presently has no cases of coronavirus, but the Department of Health continues to work closely with regional agencies in the management of the threat of the disease. Members of the public are asked to continue good hygiene measures, such as covering your mouth and nose with disposable tissues or clothing when coughing and sneezing. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing, and to seek medical attention and share your travel history with your healthcare provider if you have symptoms suggestive of respiratory illness either during or after travel. This is the Hot 7 TV Nightly News. Still to come, family and friends of Victor Morris grieve his loss with the general public in a vigil. The National Workers Union saves 100 carryman jobs, and Calypso Legacy is back. That and more after the break.